presenting a new series Medically Verbal where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Alright, guys, welcome back to the channel. Today we have got a puzzling case of a man who's short of breath, coughing, and feeling tight in his chest. But hold on. Is this just a typical case of COPD, or is there something more going on? Let's break it down and find out. So here's the situation. Our patient is a 60-year-old guy who walks into the clinic with his dry, nagging cough that's been hanging around for 3 weeks. On top of that, he's been feeling short of breath. And I'm talking like huffing and puffing just to get through the day. Now he's not coughing up anything gross, so no phlegm. Just a dry cough that doesn't want to quit. But the thing is, this guy is no stranger to smoking. He was puffing away for 30 years before he finally quit 5 years ago. Good for him, right? Or maybe not so good. Because now we are left wondering if his lungs took too much of a breathing during that time. And before I forget, he's also got a history of hypertension and diabetes. Just the usual fun stuff that likes to tag along with people as they age, right? But all that's been controlled with his meds. Metformin for his sugar and lisinopril for his blood pressure. Now this guy's pretty anxious because his chest feels tight and the breathing issues just aren't letting up. So I hear bibasilar crackles in his lungs. No wheezing, no deep crackles we might expect with fluid in the lungs like in heart failure. But these fine, crackly sounds. Now, this isn't what exactly we expect with COPD, where we'd usually hear wheezing or coarse sounds. This gives me a pause. And he's not in major respiratory distress, but his oxygen levels are hanging around 93% on room air. Not ideal, but not an emergency either. Still, something feels off. So we have to explore a few other possibilities. Well, we are not just dealing with the possibility of COPD. This guy's dry cough and these crackles could be telling us a different story. I'm thinking, could this be pulmonary fibrosis? Or maybe even congestive heart failure? COPD, likely given his smoking history, but that dry cough doesn't quite fit. Pulmonary fibrosis, could this guy's lungs be scarred up after years of smoking or from working construction, breathing in who knows what? Those bibasilar crackers? Classic for this. Lung cancer. Yes, surely this could be a case due to his smoking habit, but there's no weight loss, no hemoptysis. So maybe not at the top of our list today. Congestive heart failure. He got the diabetes and hypertension, so his heart is not winning any awards for being trouble-free. But there's no leg swelling or edema, which would usually tip me off. So what do we do now? Time for some investigations. Spirometry. We have to do it to check out if it's really COPD. If his lung shows obstruction, that's a big clue. Chest X-ray. To see if there's any hyperinflation that would suggest towards classic COPD, or to see whether we are dealing with fibrosis. And in that way, we'll find out some scarring. High resolution CT. Because this is one of the gold standard tests that could be used for picking up pulmonary fibrosis. Brain natriuretic peptide blood test. If we are suspecting heart failure, this test would tell us if his heart's freaking out and causing the breathing issue. And if all else fail, we can always throw in an arterial blood gas to see how well his blood's handling oxygen and CO2. Talking about treatment, based on what we have found, we have different ways to go. For example, if it's COPD, we would be looking for inhalers like albuterol for quick relief or tiotropium to help his breathing in the long run. And we have to also ask him to stop smoking. If it's pulmonary fibrosis, the things are getting a bit more complicated. We'll need to think about meds like nintedanib or pirfenidone to slow Hope you
down
like the case study of today.
and we'll be calling the oxygen therapy.
You can come back
if
whenever
his
you want to
oxygen
sum
level
it up.
is still too low. If it's heart
Please make
failure,
sure that this is
well,
not
in that case,
a
we
substitute
throw
of
in
medical
some
advice
furosemide
and is just for understanding
with any
purposes of
appropriate
how
and
to
adjust his
diagnose
license
and
number
solve
on
case
the item
histories.
of each number.
Thanks for watching. Corrections or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.